Hi, Dr. John Torres here on my Facebook Live Daily Doc, where every week I talk about different subjects, coronavirus, pandemic related, get some other health topics in there as well, but particularly give you information that you, your family, your loved ones, your communities can use to hopefully get through this pandemic sooner rather than later, as healthy as possible, and help you with health topics in general. Now, I want to talk about a couple of pandemic related topics, and then I'm going to talk about one that's not pandemic related, rabies, which is in the news. And it's interesting what is going on right now with that. But first, let's talk about these pandemic topics, coronavirus topics. First and foremost, I want to talk about the numbers, because the numbers are going to segue into the second one, which is talking about the CDC guidelines for isolation and quarantining. Now, the numbers, if you look at themselves, and if you remember this time last year, we were talking around 300,000 cases a day, but hospitalizations were very high. Hospitals were getting inundated. Deaths were very high. All this related to the pandemic, particularly after the holiday season 1 year ago. 300,000, we thought, okay, that seems to be a lot, and we really don't know if we're going to get much higher than that. Well, fast forward to 2022, January 2022, early January 2022, and now we're looking at 605,000 deaths, 605,000 cases a day. Those 605,000 cases, that's a 7-day rolling average, because data sometimes comes in sporadically, so they do it over 7 days. It's a daily average over a 7-day period average, 605,000 cases a day. What we're not seeing in conjunction with that, luckily, are the increase in hospitalizations quite as much, or the deaths quite as much. And the reason I'm adding quite as much is because we are seeing hospitalizations go up. Some places are getting inundated. I know hospitals here in Colorado had to call the National Guard in to help them out because of staff issues, because of hospital bed issues, because of increased cases in the hospital. We're also seeing an increase in deaths, but those aren't as much either. And as a matter of fact, in some instances, the deaths have decreased a little bit over the peaks they've had over the last couple of weeks, which tells us a couple things. One, we know Omicron, which is the new variant that's out there, is dominant across the country. Well over 90%, 95% of the cases across the country are Omicron variant. That is a very contagious variant. And so that is causing a lot of people to get either breakthrough infections or get initial infections, particularly unvaccinated, and some of those are ending up in a hospital. Now, just because the hospitalization rate is lower doesn't mean that the hospitalization numbers aren't going to be high. If we get up to that 605,000 level, which is twice as it was last year, and if our hospitalization rate is cut in half, we're talking the same hospitalization numbers that we had last year. And so you can see where it's going mathematically there. Even though the rate of hospitalization with Omicron is lower, the sheer numbers could go up because the case numbers are going up. Now, where are we in the midst of this pandemic? And right now with this big surge, are we at the end of it? Are we near the end of it? Are we in the middle of it? Is it still going to peak? By all indications, it has not peaked yet. But what we're seeing in other countries, particularly looking at the UK, they had theirs go up, and it's starting to look like it might be plateauing and possibly peaking a little bit. And if you look at the numbers here for the UK, just looking at them, again, we are 605,000, around that number there. UK 181,000. But if you look at it, it has plateaued over the last few days or so. Putting that in perspective with, as you know, I like to do it based on a baseline across countries. In this case, it's a baseline of per million people. The United Kingdom is 2,660 cases per million people. So 2,600 cases per million people. Here in the U.S., we are 1,800 cases per million people. So we're less than that. But we are catching up to them per million people. Absolute numbers, we are much higher than they are, but we are a much bigger country than they are too. And so we know the absolute numbers are there. Now, could this be because more people are testing? Yes, it could be. But also positivity rates have gone up. In some areas are 30+% positivity rates. And so we know that that Omicron is there, this variant is there, and it is causing breakthroughs. The other thing we're seeing is those breakthrough infections, particularly people who are vaccinated and who have booster shots, tend to be a lot more mild. Either they're asymptomatic or they have very mild disease and they get over it fairly quickly, do not need to go to the hospital. The other thing we're seeing is in the unvaccinated, that's not necessarily true. And even sometimes in those that are vaccinated, eligible for booster shots, meaning their vaccines have been 5+ months but have not gotten their booster shots yet, that we're seeing them having more severe disease as well. And then there's the children we're seeing. It's particularly that 0 to 5 age group that cannot get vaccinated. We're seeing increased numbers. As a matter of fact, the American Academy of Pediatrics and the CDC just came out with information saying that those child numbers are at record levels right now. And again, even though the rates might be lower, the sheer fact that there are so many people out there pushes the numbers higher. And what we're seeing as well is yesterday I did a doc-to-doc series with Dr. Fatma Levent. She is a pediatric infectious disease doctor out of Orlando, Florida, Advent Health down there. And she said what she is particularly seeing are a difference between the children that come in 0 to 5 who cannot get vaccinated, but looking at their parents and whether they are vaccinated or not. She said those that have unvaccinated parents, the parents typically end up in the hospital with them as well, and these children tend to have worse symptoms, and mainly because they were around so much COVID in their house because nobody was vaccinated that it's causing worse symptoms than them as well, more severe symptoms, versus the ones who have vaccinated parents and end up getting it some places, possibly outside the house. Those symptoms aren't as robust because the viral load isn't as much that they're exposed to. And so again, one of the big things we can do for this 0 to 5 year age group is to protect them by having everybody around them vaccinated, and what a lot of people are calling cocooning them with vaccinated people so that the virus cannot get through to them and cause the issues that it's causing or potentially could cause. Now, the other thing we're seeing is particularly in this younger age group, the 0 to 5, and possibly even a little bit older, is it's causing a condition called croup. Now, if you've ever had a child and you've ever had a child with croup, you know that can be scary, especially when you get that 3 a.m. wake up of the child coughing, and it sounds like either a dog bark or a seal bark, but it's a wet bark, and it sounds very classic for croup. Well, for croup, one thing is, as doctors, we have been treating this since day one we got into the hospital, and so it's something we know how to treat very well, but at the same time, it can be distressing for the parents, it can be really troublesome for the child, and in some cases, it can be severe. Most of the time, it's handled very easily as an outpatient, but sometimes it can get to greater stages where they need oxygenation or oxygen help. So now, again, looking at those numbers, where are we going to go from here? Well, if you look at other countries, South Africa, a lot of people are pointing at them. And what Dr. Walensky said today is if you look at their numbers, they have almost, before we talked about these bell curves where cases went up and then cases came back down. In South Africa, she's describing it as an ice pick. Went up rapidly, came down rapidly. And the question was, is that going to happen here in the U.S. as well? And her answer, which I thought was a good answer, was that most likely not, for a couple reasons. Number one, in South Africa, it's a smaller country, and people there had a heavy load of COVID over the last year and a half. And so there are a lot of people who had COVID infections and have a bit of natural immunity, so they're able to fight off this Omicron very quickly. At the same time, they have a low vaccination rate, so a lot of them were catching it in the first place and spreading it to others, and then subsequently, as we know, it spread throughout the world. Don't know it necessarily started in South Africa, but that certainly helped with the spread around the world. Probably won't happen here in ice pick fashion across the country, but what she did say is it could be ice pick fashion, meaning it goes up very quickly and comes down very quickly in different regions. And so you'll see it just kind of moving through regions, much like the pandemic has done over the last year and a half, almost 2 years, where there are certain regions that have been hit very hard, it quells down there, and then other regions get hit very hard, and it starts quelling down there as well. And so again, looking forward, it's one of those things that we know the cases are going to go up. We're not sure how well they're going to come down, but hopefully they start plateauing soon because the cases have just continued to rise. Like I said, now over 600,000 cases a day here in the United States. And even though hospitalization rates are lower, death rates are lower, the sheer numbers are pushing those numbers up higher. And so that can be a concern, and that can overwhelm the hospitals. Now, the other thing is if you talk to those working in the hospitals, they say there are two different things happening here. One of them is that there are patients coming in because of COVID, meaning they are getting sick, they are having trouble breathing, and they are coming in testing positive for COVID and being put in the hospital for COVID. Others are coming in with COVID, meaning they're coming in for something else, be it a knee surgery, be it some type of elective surgery, and they are getting tested for COVID, like all patients do these days, and they are diagnosed with COVID, but aren't really having COVID symptoms. However, even though they're not having COVID symptoms, some of those are turning to the point where they start getting COVID symptoms while they're in the hospital. So that's adding to the burden as well. And so you can see where this is going here and how it multiplies. And so overall, the message is, let's try and get this under control as best we can. And that means still doing some of those things that we are all super tired of. And that's masking, social distancing, definitely getting vaccinated, getting your booster shot, which CDC today just said Moderna, their booster shot is also now recommended at the 5-month period. And so looking at booster shots, 12 years and above, 5 months after getting vaccinated, you should be getting your booster shot, whether it's Pfizer or Moderna, for 12 to 17 obviously is Pfizer, because that's what they are authorized for 18 and above. It's Pfizer or Moderna. For Johnson & Johnson, if you got that, they're recommending a booster shot 2 months after getting vaccinated with your Johnson & Johnson. And that way you're fully boosted. And we're finding out that fully boosted is important to keep your immune system as strong as possible to fight off the Omicron in this case, which is important to try and keep things under control and get things up and running again, because that's becoming an important issue as well. But now segueing into the quarantine isolation, the guidelines just came out from the CDC, and it's causing a lot of confusion. Now, going back a few weeks, initially a few weeks ago, they dropped the guideline, they dropped the days in quarantine. Remember, it used to be 10 days quarantine and isolation. They dropped that from 10 to 7 for healthcare workers if they tested negative and were able to go back to work. Well, subsequently, for the general population, they said, we're going to drop this down to 5 days for the general population. Did not recommend testing, but suggested testing at that point, and it caused a lot of issue, a lot of consternation. So they came out with their new guidelines. They updated those guidelines, and you can see here, I have a paper here that's got a lot of writing on it. These are the guidelines, and essentially it breaks down into 2 categories, and each category breaks down into 2 more categories. And so you can see where this is going. But the 2 main categories it breaks down into, and I want to make sure people understand this: isolation versus quarantining. Isolation means either you tested positive for COVID, whether you have symptoms or not, or you have symptoms of COVID, whether you tested positive or not. Again, let me say that. You tested positive for COVID, whether you have symptoms or not, or you have symptoms of COVID, whether you tested positive or not. In that case, what they want you to do, whether you're vaccinated, whether you have a booster, whether you're unvaccinated, everyone, they want you to isolate for 5 days. And isolation means staying away from everybody. Isolate for 5 days. If at that 5-day point, after 5 days, your symptoms have improved, or if you had no symptoms and they went away, as in you tested positive but never got symptoms, and you ended up getting to that 5-day point without having symptoms, then on day 6, you can leave isolation, but for the next 5 days, so it's going to be a total of 10 days, they want you to wear a tight-fitting mask, preferably an N95 or a KN95. Again, so you can leave isolation after day 5 if you never developed symptoms, or if you had symptoms, they resolved, and particularly fever-free for 24 hours without taking medication for having that. Now, if you start developing symptoms, if they go away and start coming back, or if you never had symptoms and they start developing, then you need to stay there until those symptoms go away. That is with isolation. The other thing they say is with isolation that go ahead and, if you can, to go ahead and test. And I just want to look over here to make sure I'm telling you correctly, because again, this can be very confusing, and I want to make sure I am telling you correctly here. And they say if you have access to a test and you want to test, go ahead and test. But if you do test positive, they want you to go ahead and isolate until day 10. Again, can be a bit confusing, but that's isolation, meaning you either tested positive for COVID, whether you have symptoms or not, or you had symptoms of COVID, whether you tested positive or not. So again, can be a little bit confusing, but that's isolation. Now, quarantining gets a bit confusing as well, because that's divided into 2 different categories. One of the categories is if you're fully vaccinated and you're eligible for a booster and have gotten the booster shot. So here's the examples. You had Pfizer and Moderna, you got fully vaccinated, you're at the 4-month period, so you're not eligible for boosters yet. That's in this category. Same with Moderna, that's in this category. Or you had Johnson & Johnson and you're only 1 month after Johnson & Johnson. You fall into this category. You also fall into this category if for Pfizer and Moderna you've gotten to that 5-month point and you've gotten your booster shots, Johnson & Johnson at a 2-month point and gotten your booster shots, then you fall into this category of being fully vaccinated and, if eligible, have gotten boosted, or if you tested positive within the last 90 days, last 3 months, then they say if you come in close contact with somebody, which is 15 minutes or more of somebody who tested positive for COVID, or you think they have COVID based on their symptoms, even though they didn't test, then you need to quarantine yourself. And again, this is quarantining as opposed to isolation. Quarantining means, again, staying away from people as best you can and making sure you don't go out in public, or if you do, you go out with this tight wearing mask. And what they say is if you fall into this category of being fully vaccinated, if eligible, having your booster shots, or testing positive for COVID in the last 90 days, then you don't need to quarantine if you're exposed to somebody. Now, if you fall into the other category, which is the unvaccinated, those that are only partially vaccinated, or those who are eligible for booster shots but have not gotten their booster shots, then they want you to do something a little bit different. And what they want you to do is to go ahead and quarantine for 5 days. If at the end of 5 days you have no symptoms, then they say you can go ahead and leave after 5 days. They want you to get tested. But again, they say if you can, but they do recommend you get tested. And if you test negative, then go ahead and leave. Wear a mask for the next 5 days. And if you can't test, then they say, well, go ahead and go out and wear a mask for the next 5 days. And they also say if you can't quarantine for the full 5 days, go ahead and go out for 10 days, but wear a mask for the next 10 days. And so you can see where it can get very, very confusing here. But essentially, what they're saying is for isolation, for quarantining, if you fall in those categories, it's 5 days. If you don't develop symptoms, go out, but keep mask for the next 5 days. And it's important that you do that to keep everybody protected around you. Hopefully they come out with a little more information, get a little more clarity. It would be wonderful if they had an algorithm for it that you could just run down the checklist and go, I fall into this category, because again, it can be very confusing. Isolation, whether you're vaccinated, not vaccinated, fully vaccinated, boosted, doesn't matter. Everyone's isolating the same way. Quarantining, it depends on whether you have been fully vaccinated, have been eligible for boosters, got your booster shot, or again, if you tested positive for COVID in the last 90 days, then you don't need to quarantine. Otherwise, you need to quarantine based on their guidelines. Again, can be a little bit confusing, but hopefully that clears it up a little bit. And the last thing I want to talk about is about something we rarely hear about: rabies. Well, it turns out rabies around the world can cause a lot of issues. Here in the U.S., hardly ever causes an issue. And this is one of the things we're trained on in emergency medicine, is what to deal with somebody, how to deal with somebody who comes in that you have a potential exposure for rabies. Now, if you come into the emergency room and you were bit by a dog or possibly by a cat or an animal of some sort, then we get animal control involved, and the animal control usually wants to know, okay, is that animal fully vaccinated against rabies? Is it a known animal? Was it acting strange? All those things that we ask about. And as a matter of fact, in most states, there's some paperwork you have to fill out so animal control can follow up, because once you get bit, you only have a few days before you have to start that rabies treatment. Well, historically, around the world, over the last few years, last few decades, there have been around 59,000 people dying from rabies each year around the world. 59,000. It's a lot of people dying from rabies, but these are mostly in developing countries where rabies is rampant because the animals don't get vaccinated for it, and there's a lot of interaction between animals and humans, and a lot of bites happen, and they don't have the healthcare infrastructure to get the rabies vaccine, which, by the way, is extremely expensive. So here in the U.S., typically we see 1 to 2, maybe 3 cases a year. Last couple of years really haven't seen any cases. Well, this year, the reason the warning is going out is because there have been 5 cases of rabies, 3 of them over the last couple of weeks of the year, where they all proved fatal. Now, part of these proved fatal because one was an individual who essentially refused the vaccine. He was afraid of vaccine or didn't believe in vaccines. I think he just didn't like vaccines, so didn't get vaccinated. The other ones were in people who had waited too long to try and initiate the treatment, or thought that their bites were insignificant and didn't have to worry about it, or weren't even sure they had bites. Now, 4 of these were in bats. One was in a dog. The bats, and the reason this concerns us in the emergency room, is because bats can often leave a bite or a scratch from their mouth, from their teeth, that you don't often recognize. It used to be in emergency medicine, in the emergency room, if you came in and you told me that you woke up in the middle of the night and there was a bat in your room, and you shushed it out with a broom or somehow got it out of the room, but you don't think it ever bit you, we would start vaccine. We would start the rabies vaccine, whether we found a bite mark or not, because their bite marks can be so small. And these could be very tiny bite marks, but if the saliva gets in there that carries the rabies virus, that can cause rabies. Now, we switched that over the last few years and have not done it so much unless there's a verified encounter between you and the bat. I woke up and the bat was on me, or I see a little scratch here that wasn't there when I went to bed, those types of things. But in some of these cases, people handled bats without gloves. People had bat roosts in their house that they knew were there, but had done nothing about, and these ended up being fatal. Now, here's the thing about rabies you have to understand, is rabies, once symptoms start, which can take a few days for symptoms to start, once they start, they are 100% fatal. Again, once rabies symptoms start, they are 100% fatal. And those symptoms are usually muscle aches, weakness, headaches, fevers. Once you start getting those symptoms, 100% fatal. In the history of last few decades anyway, there have been 2 people that have been treated successfully for rabies. with a lot of antiviral medications, being put in an induced coma, those types of things, but only 2 out of all the people that have been suspected being treated or suspected of having rabies bites and being inoculated for rabies or vaccinated for rabies. And both of those ended up, one of them, not quite sure it was actually rabies to begin with. The other one has a lot of neurological issues right now, is not the same as they were before. So again, this is the type of treatment that if you think you're exposed to something, and one of these was a person who went to the Philippines, was bit by a stray dog in the Philippines, came back here and ended up dying from rabies here in the U.S. The others were bat encounters. Again, be careful with bats, skunks, raccoons. Those are animals as well you need to be worried about. And so if you go to the emergency room, if you go to urgent care, they're going to say, hey, let's start talking about initiating the rabies vaccine, which is now, it used to be you had to get these shots that were usually in the stomach area. Now they're regular arm shots. It's a few shots you get. Again, it's important you get those vaccines because rabies, once symptoms start, you cannot get the vaccine at that point because it is 100% fatal and the vaccines do not work. So there, we've had an uptick in rabies cases over the last year. Hopefully that doesn't follow suit here, but at least now you understand rabies and what it means as far as the implications for your health. But again, looking at what's going on here, looking at the numbers, we're up above 600,000 right now. Hopefully we start plateauing and we'll know more over the weekend into early next week where we're going with this. Hospitalizations, the rate has not gone up much, but the numbers are going up because of the sheer numbers of cases. Same things with children being hospitalized in particular. We're at the highest level of children being hospitalized now that we have been in the whole pandemic. Deaths, luckily, have not followed suit quite as much, and in some cases have declined, and so we're going to keep an eye on that as well. And then we talked about the quarantine versus isolation requirements. If you do get confused, one of the best things is just Google CDC quarantine requirements or quarantine guidelines, and you'll get the whole synopsis there and what you need to do. But the important part is you do follow those guidelines, so that way we all stay protected from each other, and definitely wear a mask when you're out and about. So I hope you have a wonderful weekend. I hope you are doing as well as you possibly can. And like I always say, I hope this information helps you, your family, your loved ones, and your community get through this pandemic sooner rather than later, and as quickly as possible and as healthy as possible. So have a fantastic weekend. Thank you.